today I think it's the day to discuss and to tell with us about this new technology, this RF technology that can make progress in the procedure, in the ambulatory procedure, with the surgical technique office hysteroscopy. And so it's about 1 year that we have started with this new procedure in the surgical department in the ambulatory rate. And we have had a lot of success with the patient, and to pick it up from the operating room, a lot of patients, and to treat them with this new procedure. Sorry for my voice, but I have COVID infections about one week ago, so I'm not still really bad, really good. So, per andare avanti, no. So, what do you want to remember? You have to remember that a few months ago and few years ago, you have to use operating room, you have to use anesthesia, you have to use dilatation of the cervical cervix, and to join the uterine cavity and to perform this kind of procedure that is hysteroscopy. So operating hysteroscopy, so polypectomy, so myomectomy, so metroplastic procedure, all the pathologies that is inside of the uterine cavity. And now we can say that we have a chance, a good chance, an excellent chance for my idea that you can perform this kind of procedure not in the operating room, with low cost, with low time of procedure, and with more easy technique with the patient, that it's not it's awake, it's not in anesthesia. She talked with us, and she tell us what is his sensation and his pain, and she can go at home in about half an hour, 1 hour at once. And so it's, for us, it's a big satisfaction that not all the kind of the pathologies, you know, the small or little of them, we can treat in the ambulatory room. So it means a low risk of failure procedure, because this kind of instrument are very small, and also you have to be very confident with this kind of procedure to use it. So this is we can, thanks this kind of electrode, the plasma kinetic bipolar electrode made by bones, that is very small, it's very thin. So we can use in small instruments, it's about office hysteroscopy, and we can also perform a lot of procedure that I have chance also with big polyp with about 1.5 centimeter, that with a big implant. So it gives me a lot of satisfaction. And now, if you want, I can show you some video that I performed in this month in my ambulatory room, and with obviously with the patient with no anesthesia, and using this kind of electrode. So. Abbiamo visto i video? Ah, sì. Però come ci siamo andati nuovamente? Qui. Video 007. Immagini? No, per fuori. Vai fuori per qui? No, sul. Okay, Dr. Marco Monti, now we cannot see your screen. Yes, because I'm choosing the video.
Okay.
Okay. No. Questo è l'obliterazione. This is a video about an obliteration of the external uterine orifice of the cervix. You know, if you can see my mouse, I can show you, this is the cervix, okay? And you know, this is the obliterated orifice of the cervix is completely obliterated. It's really, there is no any space to we do this procedure in vaginoscopy, obviously, and with nothing speculum application. And in vaginoscopy, it's more comfortable for the patient. And so now we have to identify where we have to do the first application of the electrode. This is the electrode bones, and I make the first hole in the cervix, and it's well tolerated. You have to use a low level of energy, so the patient don't have any pain during the procedure, during the treatment. And this is in real time. What I do, it's not a video, it's not on make on it. And I show you during the procedure what is the result of the application of this kind of energy with kind of electrode. And also the electrode you can use also to have the space inside the canal of the cervix, and to perform and to guide this kind of procedure to join the uterine cavity. You see the serous from the cavity. This is the mucus that came from the cavity, and we have opened so the cervical canal with this kind of procedure, and then we can have performed the operating and diagnostic hysteroscopy in this kind of patient that you could put inside of the operating room, and with anesthesia, with a lot of time and costs for the regional sanitary system. And so you have performed this kind of procedure exclusively in the ambulatory room, and with any pain for the patient. And and we have joined this kind of results in very easy. Okay. So here is the channel of the cervix. As I go on a little bit on, and this is, we have performed the hysteroscopy. This kind of pathology, there is a lot of pathologies. There's myoma, there is also polyps. And we start to perform. I go on with this video, and I show you the other one. There is a lot of pathology. This kind of case is not the exception for the ambulatory treatment, because there is too much pathology. I do a biopsy, and then I have put the patient in the operating room. But this is to show you that you can perform this kind of diagnostics hysteroscopy also to make a diagnosis and to have also this kind of procedure very clear. I show you the other one. I close this one. This is, you hear me with the music, or I have to, can you hear me or not?
Yeah, yes.
Yes, we
Okay.
can see you. Can see
Okay,
you. Yeah.
okay. I make low the music so I can speak about here. So this is another video about a sessile polyp with a large implant base in the front wall of the uterus, and we are inside in the cavity. This is the electrode that work very well. You know, there is very loss of bubble during this procedure and during this kind of energy. And this is a big advantage for the hysteroscopic procedure, because low bubble can see you better the operating field, and there is no noise for the bubble. That you know that the bipolar energy usually it's very full of bubble, and this kind of energy it's very easy to graduate it, and we have also a lot of possibility to perform this kind of procedure. You have to remember that the patient, it's not in anesthesia, it's kindly awake, and she talked with the operator and with the surgeon, and also with the other personnel of the ambulatory. It's very important to make the patient in his confidence and very relaxed in a good ambient, so you can stay very relaxed to do the procedure. It's very important. And so you look, this is a large implant base, and it's a polyp. It's about 1 centimeter, so it's very easy to do it. So I show you the last one, and then I can hear the other. So this is metroplastic, and you know, you teach me that metroplastic is a procedure that you have to do surely during the operating room. This kind of energy and this kind of electrode, it's possible to do this kind of procedure in the ambulatory room. It's very unusual. I know I can't understand, but you have to think in a new way if you want to use this kind of energy, this kind of electrode, this kind of procedure. And we have to change a little bit our ideas about this kind of procedure. I have really touched with hand the efficacy, the good efficacy, and the good results of this kind of procedure in my patient, in the patient which I have treated, also with the outcome of pregnancy in this case exactly. And the pregnancy, she had 2 spontaneous abortion before this kind of procedure, and after she have the normal pregnancy without any other problem.